All right. Hello, everyone. I'm Dr. Brandon Vanderwell, and I think we are live on YouTube. Let's see if we can go live on Instagram. I think we're good. Hard to tell. Just do a couple of housekeeping things real fast. And then yeah. All right, this looks like it is live. Okay, very good. We have had some trouble with the comments section. So if you are watching and try to leave a comment, I am sorry. Speaking of comments, that's the topic of today. We are going to go through some comments and go through some of my old social media posts and some stuff that's out there in the world. So let's see here. One last thing I need to do. Okay, all right. Instagram, I think, is live. So thank you all for joining. So I'm Dr. Brandon Vanderwell. I'm a bariatric surgeon at Aviva, a bariatric surgery practice in the Seattle area. And we have helped thousands of patients over the last almost 20 years now lose actually over 100,000 pounds cumulatively, totally. So yeah, we understand some weight loss things. We have some comments sections from some of my social media posts, maybe some other things that are out there. If you have comments, please try to leave them in the chat. I don't know if people are able to leave comments. That part's been a little tricky. So it's a moving target. We are trying to up our IT game, and sometimes it seems like 2 steps forward, 1 step back. All right, let's see if we can share some of this stuff. I'm going to try to keep these sections short. Let's see here. There we go. Okay, all right. So this is my TikTok channel. So let's see. Yep, we can see this here. Cool. All right, let's go through some comments. So I don't know if you guys can hear this stuff, but so this is a video I did of a laparoscopic sleeve gastrectomy. This is right here. That's the sleeve stuff, and this is the old stomach that comes out. And when this thing is like fully expanded, the sleeve does get smaller. The sleeve is a misnomer. We're not actually sleeving anything around a laparoscopic sleeve. It's really just making the stomach into a sleeve shape, not something actually sleeving it. The extra stomach part here, right here, it is going to come out and get removed, and the stomach will be about 70% smaller, which is a big, big upgrade for people. What do people say in the comments? I'm interested. How do I get full information? I'm scared. Yeah, I understand. It's kind of scary, but what's really cool about this surgery is it's very well tolerated, and it's very helpful to have a smaller stomach in the 21st century. Hardship and scarcity have defined life on this planet for as long as we've known it. And just in the last few decades have, comfort and abundance just become our main problem and vice when it comes to obesity now. So it's a major problem. So it's very helpful to have a smaller stomach. Don't be scared. It is, you always take these things seriously when we're doing surgery, but I did talk to a patient yesterday. So one of the things I recommend to patients before they do surgery is to actually do some strenuous exercise on the run up to surgery. With doing strenuous exercise, as a comment of, if you do this strenuous exercise, you are less likely, you're actually going to be feeling more discomfort during this exercise than you probably will during your recovery from surgery. So, which is crazy to think. I've wondered what it looked like from the inside. First video I've seen. Thank you. You're welcome. 10 weeks post-op. Congratulations, Lily Lynn. Back in 2023. Hope you're doing, still crushing it. All right, 9 months, 130 pounds down. Best choice ever. 4 months, 70 pounds down. Feeling great. Why did you stop? I wanted to see it all. I guess there's maybe a little bit of the stomach left. So there's a little sizer in here. You can actually tell. There seems like there's a tube inside the stomach, because there is. Through the mouth, we actually put a tube into the stomach to size it so it's perfectly the same size every single time. And yeah, so all you have is this nice, small, thin, banana-shaped stomach really left. Okay, best decision of my life. 6 days post-op. Hard to get on liquids. Down my stomach, says no. Yeah, yep, stomach going through a major change here. So a big part is that not only is your stomach smaller and there's some swelling, but actually there's a neural mesh around your stomach that coordinates the peristaltic movement, which is the pumping, moving action of intestines. And that movement is disrupted with the surgery. It will take a week to 2 weeks to kind of really coordinate and realign that up. So it is a little bit, you want to take it slow, take it small amounts. But 1 month post-op today, never knew stomach was completely attached. All right. I want to get bariatric surgery so bad. I didn't really know my research about bariatric surgery. Weight loss surgery for many years now. All right, yeah, go for it. Can you show me how a gastric bypass looks? I think I do have a gastric bypass look we can take a look at. Just had my surgery this Thursday, can't eat. That's the hard part. With due time, it's worth it. Yep, follow your program, totally worth it. Is it reversible? It's not really reversible. You can't really put that stomach back in. That other part, this part right here, this is gonna come out, actually. This is gonna get removed from the body. It's able to come out of an incision the width of this finger. It's kind of like an octopus, how octopus can kind of squeeze into any tiny little shape through any tiny little crack. That's similar with this, actually. That stomach is just a big muscle, and you can actually squeeze it out of a very, very small hole. Maybe Ashley has a appointment in a few weeks. Awesome, Ashley, go. Will the stomach grow back or expand? It can stretch out. It's not going to stretch out to its previous original size, but it can, again, get much larger again. The reason that happens is if people are stretching their stomach, like putting their stomach on stretch on a regular basis. Think about that eating contest guys. So like that that skinny little Japanese guy, Kobayashi, who was the eating contest champion for so long. He practices stretching his stomach by eating lots, drinking lots of water, eating lots of food super fast. And the same sort of principle can happen, is that if you push your stomach to its limits too far, it will stretch out over time. Where in Lagos are you? We are in Seattle, Washington. I'm curious, since the greater curve is cut off, what supplies the new greater curve and what happens to the epiploic vessels? Good question. So there are 5 major vessels that feed the stomach. The stomach gets a lot of blood supply. Very well supplied organ. The lesser curved side, so you have your left gastric artery here, your right gastric artery is going to be coming in right about there. That spongy looking thing, actually, that's the pancreas above there. The gastroepiploics go here on the outside, and you actually, you fuse these, you cauterize them so that you don't have any bleeding. You actually have you lose less blood from this surgery than you do actually getting your labs drawn. So the left, and then there's some short gastrics that come off the spleen, and they're coming from up here. And there's a few of those still intact, but most of those are disconnected as well. The left gastric and the right gastric are totally sufficient to supply the blood supply to this size of the stomach. Actually, even just one artery on a normal stomach can supply the entire blood supply for a stomach in most cases. So even with this, like, stomach is good to go. It's doing great. Yep, left, right gastric arteries. Some soreness on the right post-op. 3 years post-op, 264. Wanted to lose more. Let's put on Wegovy, down another 20 pounds. Great. Hopefully you're still doing great, Marianne. Do this. Yep, these are tools. They're not cures. They're not magic wands. I wish I could say they were, guarantees. Losing 64 pounds is that's okay. It's certainly better than nothing, but I think most people that are 264 really want to lose a little bit more weight than that. At least, most ladies. Most men, probably need to lose a little bit more too, but it just depends on who it is. So, Do the staples dissolve? Good question. These are titanium staples. They do not dissolve. They do get sort of incorporated. Your body sort of grows around them. If you go back in and look at surgery, you almost never see them. The scar tissue has really turned it almost into native tissue. If you look at it endoscopically, you can't really tell where those, you can't, you'll never see a staple out there either. You can tell where it's sort of fused, where that line is, but it won't. The titanium means also that it won't ever set off a metal detector. It's not magnetic. You can get an MRI, no problem. Is the pale side of the stomach the one that comes out? Yes, it is. That is the part that comes out. Yep. Love to see a bypass. I'm having the bypass done soon. Great. Got some other bypasses. How would you handle all the cravings since 6 days post-op and recommendations? Yeah, so this is a good question, just diving into it. This is why you want to have a really good relationship with the team that's doing your surgery, because sometimes everyone's experience is a little bit different, and making sure that you are there, that you can ask questions and get help with what you need is really helpful. What happens to the cutoff part? We take it out. 6 days post-op, everything been great, awesome. Take your time, excited for pureed. Any recommendations? Yeah, take your time, follow the program. It's great. So, yes, sit some just like that. Correct. Yes. Wish my insurance covered bariatric surgery. Yeah. Trish, hopefully you've been able to get it sorted and gotten some help. Do the staples dissolve? They do not dissolve. First consult. Yeah. I know it's scary. It is scary, but what's really cool is that particularly in experienced hands, these surgeries are very safe. They're very effective. And you can really get through this we're going to get you through. So, all right. Okay, let's go to the next one. So let's see here. Let's remove a stomach. Oh, so here in this video, we're going to show the removal of a stomach. So we're taking it out of a small incision. All right. Yep. I've been looking all over so here's what it is. So you got the small incision there. And so sorry, this is going to be a little bit, maybe more than some of you were expecting to see. So, and you can just give it a nice just a little bit of wiggle, and boop, you can get that thing out of there. And if you blow that thing up, it blows up into a really big part. I think a lot of you probably don't want to see this over and over, so I'll pause it as we go through these comments. Looking for the video, how you actually remove it. Thank you. Yeah, you're welcome. Sleeve done 2 weeks ago. Interesting. Waiting for my surgery date. Excited. Scared. Getting mine done in 2 months. 2.5 weeks post-op, down 223 pounds. Nice job. I had gastric bypass 12 years ago, and my stomach is just hanging out in there, chilling. It is, yeah. In a gastric bypass, it actually stays connected to all the extra part of the stomach, stays connected to its blood supply, and you don't actually remove it. You just bypass it. You go around it. Wonder why this looks familiar. Dr. Landerholm did my surgery. Yep. Very good. Awesome. Kristen. 4 months post-op, 75 pounds down, doing awesome. So glad I found this page. You are the best doctor. Almost 3 years out. Thanks, Anna. 13 days until my surgery date. Awesome. I love this. I've wanted to see this so bad. I didn't have one specific incision, but the side they pulled it out of was like the worst pulling pain. Yeah, it feels like it's a pulled muscle there, because the incision does go through the muscle there, so it feels like you have a strained muscle. That's what the feeling's like. So kind of like a strained muscle. It takes a little bit of time. It talks to you a little bit when you move around. But and I still like a strained muscle. You're like, oh yeah, I'm going to recover from this. Sleeve done in March, 5 weeks post-op. Okay, look like a hot dog coming out. This is so nice. See how it's done. Cool. All right, good. Doing well. Surgery soon. Why this is so cool. My doctor records. 3 years out, best decision ever. Sign me up. All right, curiosity satisfied. Very cool. I really didn't think people would care to see this, but I guess there's quite a few comments, 100 plus, about, and a number of them would be like, I really wanted to see this. How did this work out? So the marvels of TikTok never end. So, all right. Surgery coming up. Can you remove mine, please? Thank you. Yeah, let's do it. Let's go. Had this done 9/5, suffered a leak. Had a JP drain feeding tube, officially on fluid liquids now. Great. Yeah, it is possible that there are issues, knock on wood, very unlikely. Leaks are very, very uncommon, especially in stomachs that have never had surgery on them before. Like the chance of you getting a leak is very, 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 very low. But it's never zero. But if the thing is that if there is something bad that does happen, it's why you want an experienced team that is close by you and they can take care of any problems and get you through it. So, mad to think it was me on that operating table 13 days ago. Crazy. Maddie. All right. Can someone explain what's going on here? Taking out the stomach. You ever done a sleeve or bypass through a bikini cut? That's what mine says he has to do and can't find that's being done before. I would not do one of these surgeries through a bikini cut. The bikini cut would generally be way too low. Your stomach and stuff is up here. Bikini cut's very low, and the challenge of getting up over and to do that stuff would be very challenging. So, if you really want a surgery that's the most cosmetic, doing the endoscopic sleeve gastroplasty, which is where you have the suturing device that goes down through your mouth and sutures the stomach closed tighter, smaller from the inside, crumples it down. That's the one that you want if you really want to have minimal scars. So it's also possible to do this surgery through just the belly button. I do not do that surgery. I don't offer that surgery just because I don't feel like it's as good. You don't have as, if you're going to do a laparoscopic sleeve, I would get those small incisions. We do take a lot of care to get them up nice and tight, nice and small so that it heals really well. But I think you just need a little bit. You have a lot of higher risk of incisional hernias from that belly button site if you just do the single incision. So I generally don't offer those because I don't feel like they're quite as good. All right. Oh, I have 1.3 million views on this video. Okay. This is what's going to happen. This is what looks like inside your stomach. Look at that. So this is the expanded part. That part right there, that if we blow up that piece that we just pulled out, if you blow that up, that is what that looks like. It's a lot of volume. You can see how like that's a literal burrito. So I mean that's like what your stomach is. It's a burrito bag. It just wants to eat burritos. So it's just very helpful to have a much smaller size stomach. And this we'll see here. Bad stuff. So that's nice sleeve stomach. That's where that goes. So this is that tube I was talking about earlier. That's the thing that goes in there, fits inside there. It gives us a nice sizer action. Yeah. It works really well there. All right, Cassie says a lot of people don't know or don't understand that you lose weight, but you lose a lot of the capabilities your stomach was able to do. Oh, this is interesting. Cassie, okay, like what? So generally, your stomach is a breakdown organ. That's what it does. It doesn't really factor into a lot of absorption. It doesn't do absorption. It helps you break down things so that you can then absorb them later. There's very few things, nothing that I really know of that your stomach can't do when it's just a smaller size. It's not gone. It's not completely removed. And we do surgeries like, any general surgeon background has done surgeries and has taken care of patients who have had their stomachs completely removed and have other things. There are things you need to potentially supplement from a vitamin standpoint because they may be more challenging to absorb, but not really like that's very, very uncommon with just a smaller size stomach. I really describe these stomachs as the 21st century stomach. If most of the population had this size stomach, they would honestly be doing great. It's very challenging to live in comfort and abundance when you have such a large size stomach. Intrinsic factor production, which causes low B12 absorption, leading to anemia. So the rates of anemia after sleeve gastrectomy is very low. And usually with even just modest iron supplementation, we're just fine. It's very rare to see patients that have pervasive iron deficiencies after a sleeve gastrectomy. After the endoscopic sleeve, where you just suture it down, you make it tighter, you don't remove anything, it's very, very uncommon to see, iron deficiencies there too. So let's see what else people say in response to this of Cassie. So I have no issues eating food. I enjoy so much more now that I'm not eating junk, and having surgery was the best thing I ever did. That's a good thing. Sugar is not good for you. Let's see. Like what? Because I'm 3 years out and no, like what? Because I'm 3 years out now and 10 plus years post-op, no issues. I suppose you're, yeah. So Lex sounds like they had a surgery many years out and they're like, what? Am I supposed to be having issues? This is the most common thing, is that just having a smaller stomach is very helpful. And it's a very helpful tool to just to have a smaller stomach. Your stomach mechanically digests food. Your small intestine does the absorption. Genesis 100% agree. Yeah, totally, totally agree. Yeah, I'm curious what capabilities. Your stomach absorb vitamins and nutrients from food. That's not true. Your stomach doesn't really absorb stuff. It breaks it down. A lot of other people having complications and not following the instructions from doctors are not the same. Please come with facts, not opinions. Lex is coming in strong here. Have you had this surgery before? I have, and the complications are not the but to the bypass, or to the bypass, not the sleeve. So that is, I would say having more vitamin deficiencies and mineral deficiencies. That's a real thing that we need to guard against and have a plan for with the gastric bypass, because you do bypass the first part of your small intestine, where a bunch of things are preferentially absorbed. With a sleeve, you still have that stuff intact, and the chance of you getting, pervasive deficiencies is very low. So, all right. Standalone ER. I'm listening to all the doctors and nurses around me. Okay, so the standalone ER people, yes. So these are the people, these poor standalone, the ER people that see like the people that are really struggling after gastric bypass. Sometimes they're done out of the country, things like that. They don't have the support. Yeah, they have a very isolated view of all the things that go wrong. There are there are hundreds of thousands of patients that get bariatric surgery every year. The complication rate for a bariatric surgery is less than the complication of almost any other elective surgery that we do, including like getting your gallbladder taken out, getting a hip replacement or a knee replacement. The complication rate is less than those surgeries. So is there risk to anything that you do in life? Absolutely. Anything can go wrong at some point to someone somewhere. The chance of that happening in surgery, especially if you have, people that are very experienced, is low. 1 year post-op down with the consequences, X-ray tech, way too many patients with complications, days, months, years after. I could never get this done. Too scared. So yeah, the X-ray tech people, they'll see the very, very narrow people, the very sliver people that are having issues. And there are people that have issues. And I would say the bypass is a lot more drama than a sleeve is. There's much less issues with sleeve patients. And they have a very, distorted view of the sleeves, because they see the 2 people out of a year maybe that have some issues that they're trying to work through. They don't see the hundreds of people that you did surgery on that are doing great. So, and honestly, I've had, for some of the patients that I have had complications that I've done surgery on, like a couple people with blood clots, a couple people with bleeds that we got, that we had to watch or do something else, or I needed another procedure to help with. All of them have still said, I'm still really glad I did this. I'm still, that was kind of a rough course, and it kind of sucked there for a little bit. It was a little bit rocky, and I wish that hadn't happened. But I'm still really thankful that I am where I am. I'm thankful I did this, because I wasn't going to get here without it. All right. Easiest bariatric surgery, but also the most common to have weight regain. They don't tell you that. It does truly work, but you have to change your, I'm imagining, behaviors. Steph Miller, truth. So the laparoscopic sleeve is the easiest bariatric surgery for most patients to tolerate. Like, it's just very well tolerated. It's very safe in the right hands, and it works generally very well. But it's also because it's more simple, there's not as many defenses for, if you get off the plan. So with a gastric bypass, when you don't absorb things as well, even if you're not following the instructions as well, there's a little bit more of a buffer there from a weight regain standpoint. But with a sleeve, it's a little bit tighter, because, it's just a smaller stomach. So you're right. If you change what your behaviors are, if you change your plan, if you change some of those things, the ability to use this tool well to maintain your weight is very, very good. It's very, very strong. So. All right, I had mine back in 2014. Best decision ever. Kept off the 135 pounds. 5 years post-op, down as much as 130 pounds. Kept 110 off. Wow, that's a drastic change. So here's something I would like to comment. We've already seen in the comments so many times here, over and over and over, I've lost a lot of weight. 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 Bariatric surgery is the best tool for helping you lose weight. Hands down, no questions asked. When you do any study, when you do look at any sort of amount of data set, comparing it to, particularly like diet and exercise stuff, You'll see diet and exercise transformations on the TikTok videos and whatever. It's true. It's totally out there. The problem is that number one, it's very rare that those people see. It's very rare to see success like that. When you go to the comment section, they're not blowing up with like, oh yeah, I totally did this and I lost all this weight and I'm been able to maintain it off too. It's like, man, I wish I could do this. Man, I wish I could do this. This is really, really hard. What's nice about bariatric surgery, it is surgery. You have to take that part seriously, but we can get you through it we can get you through it. And we're going to prepare you to get through it. We're going to prepare you to use that tool. And that's the nice thing is that the average person can use this tool very well and see success like they can't see with anything, including the medications. Medication, real life data. It's just, we generally need to do better. It's about 9% for semaglutide in real life, about 15% for tirzepatide. And our real life data for our laparoscopic sleeves is 30%. So it really gives you a great tool, and it's so much more durable because it's really, if you have a normal stomach and you get off of those GLP-1 medications, it's challenging. It's challenging to maintain your weight. So, all right. Let's see, is there the gastric bypass video around here? Here we go. All right, gastric bypass video. This is maybe the last one we'll do for our comments section here. I don't think it looks like I'm getting comments that they can't comment. I'm hearing through back channels. So, yep, that's your normal stomach. You take a section out of it there. That part here is going to remain. And then you take a piece of small intestine, you bring it up, you connect it there. Perfect. So then what you see is that food goes down that channel and meets up with the digestive enzymes. So, C says, I literally had this surgery on the same day you posted this video. What happens with the rest of the stomach after reconnecting? So the rest of the stomach down here, this is called the remnant stomach, and it's actually just going to chill. It just stays there. It still makes some proteases and some gastric juices, and it goes down. You see this green line. It connects up with this stuff secreted by the pancreas, and it's going to go down about another 100 centimeters or so, and then rejoin with the rest of your food line, and then it's going to help start, give that extra boost of breaking that food down afterwards. Is there any way you can explain how the connections could be connected, but in reverse? They cut 225% due to malpractice. I'm not entirely sure what this means. But so these connections can be reversed. You can put them back all together if you really need them to. It's not the easiest thing in the world, but it generally can be done. So hope everything's working out with your mom. Johan. Love your page. Thank you. Perfect. I've been asked many times how this is done. Now I have a video to show them. Thank you so much. Gastric bypass, and this was cool to see. Do patients have to take vitamins for life? I think it's a really good idea to take vitamins for life if you've had a gastric bypass. What is a better option, gastric bypass or a sleeve? That's a good question. It's hard to say. The one operation isn't necessarily better for everybody versus another. In general, the gastric bypass is for people that have worsening diabetes, worsening GERD, or have a lot more weight to lose. The gastric bypass can have an edge over the gastric sleeve. That being said, the laparoscopic sleeve might still be a good option for those people as well. Really comes down, you should have that conversation with your surgeon. It's a nuanced one. I used to play with felt in kindergarten, by the way. I can barely hear you. Sorry, Jamie. They just did a fund application for my reflux and it didn't work. Now I'm back on meds and possibly need another. I'm sorry, Melinda. Yeah, a couple things that go into that. If you also struggle with your weight, this might be a good option. Can you do a video for the duodenal switch? That's a good idea. A few years ago now, but that wouldn't be a bad idea to kind of explain that a little bit more. Can people with ulcerative colitis get this procedure done? Yes, you can get this procedure done with ulcerative colitis. We do need to talk about it though. Is this more aggressive than the sleeve? Yes, it is. You can tell there's just more moving pieces here. There's more, and it's a more complicated machine. Anytime you have a more complicated machine of anything, you can have more issues that go wrong short term, more issues that go wrong long term. So it's more aggressive. It does get better. you know, there's some advantages on certain things like the diabetes, the heartburn, and the potentially a little bit more weight loss as well. So it is, you know, it's about weighing and trying to figure out what's going to be the best choice for you. Enjoying your content, very informative. Surgery scheduled soon. Awesome. All right, guys. Well, I think that hits up our 30 minutes. Thank you all for tuning in. And it looks like I don't think we were able to get our comments working again. So I'll have to look into this and why it's not working better. But appreciate you guys all tuning in, and thank you. And looking forward to, you know, if you need us, we're at avivamd.com. You can reach out if you're looking for help with your weight as well, or your health. These tools can be really very great tools. Have a great day.